was going through a lot of financial crisis, also driven by poverty, ill health and loneliness. All of this pushed them on the brink to take such a drastic step.
Depression, I guess, occurs because of not talking about it. So I think people should really talk about depression, and people should take it seriously.
It's a serious matter, and it should be treated as something as endemic as perhaps cancer.
Our government should look forward to do something in the topic for education.
A lot is being done by NGOs and all, but I feel the government needs to take more proactive steps in that.
India ranks #1 in the world in depression. And I want to tell you why we're talking about this. The photograph that you see on your screen is part of an extremely distressing story that we've heard in the city over the last couple of days. Everybody in the country, tonight over your dinner, you need to sit up and listen to the conversation that we are about to have. The people in that photograph committed suicide. The gentleman was an engineer. The lady was a gynecologist. She was a doctor. They were having financial trouble. They were having health issues. Their daughter, who was 15, was pulled out of school because she wasn't able to pay her school fees. All three of them hung themselves. The question I'm asking tonight, viewers, is do any of us or all of us, do we know what the telltale signs of depression are? Look around your living room today at the person sitting next to you. Do you know? Have you asked those questions? Are you keeping an eye out on your family member to make sure that person is not going through depression? Are we being careful enough? Are we treating this with the kind of gravity and the seriousness that we need to treat depression with? Are we talking about it enough? We need to know, in the very least, what the telltale signs of depression are, so that when someone close to us, friend or family, is going through depression, that we can tell, that we can reach out, that we can save them. Because believe it or not, in India, we lose more people to suicide than we do to murder. The statistics are shocking. And it's all because we don't know enough, we don't talk about it enough. So today I'm dedicating 1 hour of programming on this channel to simply talk about how we can tell that there are telltale signs, how we can reach out if we suspect that someone is going through depression and someone is in distress. And more importantly, I am putting on your screen right now, right there is a telephone number. Call us if you feel you are in distress. We have people on the show who will help you. You don't have to give us your name. You don't have to give us any of your details. We are here to help you, and we will make sure that we put you in touch with someone who will help you through this. The idea is to tell you that we are here and we are listening. You are not alone. Joining me on the show this evening to help us understand depression better and help us answer questions and, of course, save as many lives as we can, Dr. Harish Shetty is a psychiatrist. Shrradha Sidhwani is a clinical psychologist and a psychotherapist. Dr. Sagar Mundada is a psychiatrist and the youth wing head at IMA. Sana Iqbal is a biker and an anti-depression and anti-suicide speaker. Hrishikesh Kanan is a radio producer and a host. Kashyap Swaroop is a stand-up comedian. Abbas Momin is also a stand-up comedian. Incidentally, over the last several weeks, the people who came out with the strongest voices to help others when it came to depression were the stand-up comedian community or the comic community of the country. And for that, I appreciate the work that they have done to make sure that we talk about all of this some more. I'm going to start with Dr. Harish Shetty. Dr. Shetty, what are the telltale signs of depression? How do we know if there's a family member sitting next to us right now who's in distress?
If he or she is withdrawn, quiet, lazy, irritable, feels hopeless, feels worthless, wants to stay away from the public gaze, avoids going to work, avoids going to school, the family is isolated, it would not come down from the building, would not take part in activities of the building, of the community, of the office, crying, sadness, excessive tiredness, vague pains across the body, wanting to go to God, wanting to leave the earth, wanting to run away, saying bye and thank you to a few people, making a will suddenly, talking about loss of meaning in life, talking about things such as there is no point in living, I am a burden on this earth, are some of the signs and symptoms of depression. In this case, what is very important is, if you are staying in a building, it's important to know whether a family is getting isolated, a family is not seen around much and they are living behind closed doors, a family which has not taken their newspapers inside, the milkman knocks and they don't respond, the others also, sundry others who come to families to give goods and they knock and they don't respond. You need to really knock and find out whether they are depressed. Middle class people don't talk about financial hassles. They're ashamed to talk about financial hassles. Yes. Shame is the most important obstruction for depression. And that is something we need to break.
Kashyap Swaroop, why is the stand-up comedian community talking about depression so much?
Faye, I think one of the things that is obviously a highlight of the stand-up scene is we're expressionists, so we need to talk about things. And quite often depression becomes something that's an area to make laughter out of something that's very gloomy, and that's what stand-up is all about, right? You take something that's tragic and then suddenly you make it funny. And then people can relate because everyone's been sad at some point of time. Of course, I don't want to mix sad with depressed. That's not what I intend to do. But everyone's felt hopeless. Everyone's felt complete lack of, I think, potential. And when you feel that way, it's just the most relatable kind of state of being. And which is why we really, like to talk about it. But it's not just that we like to talk about it. We like to kind of flip it around and say that, okay, there's something to laugh about. There's a silver lining of sorts. So I think that's why we talk about it, and everyone consciously makes it. We're activists also in a way. A lot of stand-up comics want to make an impact, which is why we talk about depression and death and suicides and things like that.
I want to bring in Sana Iqbal. Sana Iqbal is a biker who ran a fantastic campaign across the country, willing people to talk about depression more. Sana, tell us what you went through and why you became an anti-depression, anti-suicide speaker.
Sure. So, see, like everybody else, even I had a lot of challenges in trying to understand what I wanted in life, certain expectations that I had which were never met. So, like every person goes through a lot of ups and downs. Now, some people choose to remain in the downs. They don't even want to come out of the downs. So, what I wanted was either happiness or no life. I didn't want to lead a life in between, what I see a lot of people living right now. So when I was on my ride, I noticed that people are reluctant to talk, and they feel that nobody can understand their problem, and that is a primary reason that they don't wish to talk to anybody. Now, when they don't wish to talk to anyone, they are already closing all the doors to come out of depression. So now, there's one thing, rather I can say it's an appeal that I want to, talk about right now, that don't expect anybody to understand your situation or your plight, because nobody is supposed to understand your situation. Talk about depression, talk about things that make you sad, and at the same time, talk about a solution, think about a solution, and the one who is listening to the problems, the so-called problems, divert the other person towards solutions rather than digging deeper into the problems. So this is one approach which I feel personally helps. I have used this approach to help a lot of people, and there are a lot of other things too, like for example in this particular case for what we are talking about today, I personally feel, I can be wrong, I feel that it could also be because of body shaming. Now, we live in a society wherein we condemn people if they are not common like us. So it could be one of the reasons why, not the only reason, but one of the reasons why
Dr. Harish Shetty pointed out, you're right, Sana Iqbal, Dr. Harish Shetty pointed out that shame, for whatever reason, is one of the main reasons, whether we're ashamed of our financial situation, whether it's body shaming, any kind of shaming. And the question, so we heard what the telltale signs are. Shrradha Sidhwani, what do we do if we suspect a family member is going through depression? Just asking, are you depressed? Does that work? Because a lot of times the person might turn around and say, no, I'm fine. What do we do then?
I think just to add to the telltale signs with which Dr. Shetty has elaborated on, a significant change in the personality is a very important telltale sign. If you notice your spouse or your friend going through it, I think the first thing to do is to ask them. One of the most important things we see is that people find it very difficult to accept that they're feeling low, that they're feeling sad, they're feeling depressed. And that's where the barrier comes. So once the person starts accepting, maybe they can go in for therapy, go and see a doctor and start talking about it.
So a lot of times there is a tendency to turn around and say, chal na yaar, let's go out, get a drink, you'll feel better. Or let's go out, watch a movie, you'll feel better. How dangerous is it to sort of brush this entire situation under the carpet?
It is quite dangerous, but I think it takes time. So there are times where people take years to realize that they're depressed. They come after maybe a year. When you just said, you know, let's go out, take a drink, alcohol is one of the biggest depressants. It chemically depresses your system. And we see a lot of youngsters going that way, you know, taking alcohol, you know, just to relax themselves. So I think the earlier you go, the better it is.
And, you know, this is something I really want to talk about. Dr. Harish Shetty, depression is a disease. Like cancer is a disease, like diabetes is a disease. It is not because someone is not tough enough to fight life. So to turn around and tell a person, why are you sulking? These things happen. Let's move on. Get on with your life, man. That is actually like telling somebody to walk off cancer, isn't it?
Yeah, absolutely. In fact, when people tell depressed people, stop thinking negative, that's the biggest insult and that's the biggest traumatic sentence you can utter. Depressed people don't think negative, the negative thoughts come, and that is very, very important. Also, depression can affect anybody. It's a secular illness. It can affect educated, the uneducated, the literate, illiterate, both the genders, poor, rich, etc. And what is also very important is that there may not be a trigger and there may be a trigger. 100 triggers affecting 100 people may not have the same response. So when you diagnose somebody very severely depressed, don't go back on the trigger. First take him to a safe place, initiate treatment, psychological counseling and medications, and slowly look at the triggers. Sometimes the triggers may be very small and the depression may be very big. Science has still not reached the stage where we know why somebody is depressed. We only know what we can do and how we can help him, and that I think is very, very important. As you rightly said, diabetes, hypertension, depression are illnesses. They are not caused by bad omen, they are not caused by any black magic, any witchcraft, or they are not caused by bad neighbors or bad relatives. It is just that the fuse of the mind just goes off because of a trigger or because of no trigger. When the fuse is off, you have to repair the fuse. You can't look for the trigger. In malaria, we don't chase the mosquito. So in depression, we may not go after the causes immediately. In mild depression, where there are causes, then go for the causes. When there's severe depression, the causes don't matter. The illness is important and we need to really treat the illness. If I'm hit by a truck and if I have a fracture of the leg, just arresting the truck driver will not help my depression. Similarly, when I have fracture of the mind, first psychological counseling and treatment, medical treatment are both necessary.
Well, I want to point out to our audience one more time, if you've just tuned in, there is a phone number at the bottom of your screen. You can call us if you believe or if you suspect that there is a family member who might be in distress and you're not sure what to do. You can call us if you yourself are in distress. You needn't give us any of your contact details or your name. Hrishikesh Kanan, I had my team look through these numbers today and the numbers are shocking. This is the number of murder victims in India in 2015, 32,394, according to the National Crimes Bureau. The number of suicides in India in 2015 was 1,33,623. Suicide is the second leading cause of death between 15 and 19 and 29-year-olds. Young people are dying, Hrishikesh Kanan, in our country of depression.
You know, there's something fundamental we need to understand here, is that from time immemorial, we have always been taught in Indian culture to look inward when we have a problem. The greatest seers, the greatest saints always said, don't be extroverted about it. Look inward to find the solution to your problems, whether that's meditation or dhyan or prayer. So we've never been encouraged to actually flaunt our problems by talking to a professional counselor or to a bunch of people, because that was looked upon as a very Western philosophy of having to talk to somebody. You know, the traditional Hollywood movie of why don't you talk about it. So in that aspect, I'm really glad that you might undermine celeb value in this, but somebody like a Deepika Padukone coming out and openly saying, I had problems on the depression front. I got over it by speaking to a counselor. And I think now millennials are realizing that. But if you look at us, children of the 80s and 90s, we always had problems expressing ourselves when we were going through the most traumatic of times, because that was how we were raised, which is tackle it yourself, go inside. So it's wonderful that celebrities are putting a foot forward. People are turning around and saying, millennials are turning around and saying, if Deepika could get over it, I can. It's not wrong to go and seek professional help. So I think there is a spark or a light at the end of the tunnel.
Well, I want to bring in Dr. Sagar Mundada. Tell us how patients are treated when they come to you. Is there a stigma still attached to seeing a psychologist or a psychiatrist and asking for help? Are people ashamed of the fact that they need professional help? Are we still a society that treats people badly if they think they need help?
Yes, I would definitely say so. If you just leave aside perhaps 1% of the population, still a majority of the population feels that depression or any kind of a mental tension or a mental illness is some kind of a thing that you really, really need to be ashamed of. We get patients who have been depressed, as ma'am also said, who have been depressed for years together and they do not show up to the clinic only when they try to kill themselves or only when somebody really notices that something's going very, very wrong. He used to be a very cheerful person at one point of time, and today he's so withdrawn that he doesn't speak to anybody that comes to meet him. So definitely I would say there is a lot of taboo associated. More importantly, I feel the educated class. One would suppose that the educated class would be more open about this. But I have had many patients, and I think Dr. Shetty sir also must have had many such patients, wherein we have the educated class who are so apprehensive if we tell them that you're depressed and perhaps you need to start therapy or perhaps you need to start medications. They are so apprehensive to accept the fact that they could be depressed. It's almost like it's very difficult for them to accept. Some people just don't want medications. You can explain to them however you want, how much ever you want, but they will not accept it. And the thing is that this is the educated class which is doing so. That just gives us an idea of the gravity of the situation when we consider the uneducated class. So I think if you leave aside 1% of the population, majority of the people, majority of the parents, majority of the youngsters, majority of the doctors also, I would say, are still very unaware. I have many doctor friends who sadly have been suffering from depression, and they themselves do not come out in the open. They tell me, yeah, I want to get treated, but let's sit in cafe coffee day and let's get my treatment over there. They don't want to come to the clinic or they don't want to come to the hospital. So if the medical professionals themselves are having so much taboo about this, you can think of the general population what the condition must be.
In fact, we're getting phone calls. I'm going to patch some phone calls in. Russell is on the phone line from Lucknow with a question for us. Russell, go ahead. Russell, can you hear me?
Hello.
Hello. Go ahead. We can hear you.
Sir.
Go ahead.
Fine, thank you.
Go ahead. What's your question?
Yeah, my question is how to save teenage children from depression. Because once they go to 11 and 12 standard, they have a lot of peer pressure, pressure from teachers, pressure from parents. They have to score very good marks. They have to appear entrance examination. So they are under tremendous pressure and they are coming under tension and depression. So how to make them relieve from depression?
Right, I'm also going to take another question because it's related. Francis is on the phone line from Jharkhand. Francis, go ahead.
Actually, I am working with the youngsters for about 2 years.
Mm-hmm.
The problem is that many of the youngsters come with a problem is that parents don't support them. That leads them to go into depression, especially study pressure from the school pressure, and how to help them, because I am not a clinical psychologist as a trained one. When the youngsters are facing such problems, I can give you solely as a company or a guidance, help. What they need is something practically which can help them. How do you respond to this?
How do you respond to that? Dr. Harish Shetty, this is obviously a big problem. Young people who are in high school, who are in college, feeling the pressure to be successful. Yes, go ahead.
Both questions are related. First is all college kids should find time for some play and see that they don't sit at night on WhatsApp and sleep early. Sleep hygiene, play and a little yoga are preventive factors for stress, and if stress is prevented, depression may be prevented. But if you are with students and if you are really working with students, if you find a student grades dropping down, he has a broken love affair, his parents and he or she are fighting for a very long time, there are financial hassles, there are teachers who are breathing on their neck for assignments and they are not able to cope, they remain isolated and they don't come to school or college, that's the time you need to befriend them. But when you befriend them, identify whether they are stressed or depressed, and that's a very fine line, which means after befriending and after support, reassurance and some activities, if they improve and if they are back on the routine, then it could be stress. But in spite of all the activities around them, exercise, yoga, good sleep, still if they remain behind, please understand that this cannot be treated by a teacher or a friend. The best thing what they can do is to escort them to a friendly neighborhood psychologist or a psychiatrist immediately and go through a mental health checkup. A mental health checkup is very important to identify whether one has clinical depression, one is suicidal, and one needs medications or counseling. I think that is very important. As a preventive measure, exercise can really dissolve fears, tears and anger. And low moods can also be because children really sit in their rooms and sit for long times on video games, on iPads, watch internet for a very, very long time and deprive themselves of sleep. If children have had episodes of attempting suicide in the past, if children have had depressive episodes in the past, they are at high risk. If teenagers have had actually family members who have had depression, then they are at high risk. If teenagers have learning disability, are alone, are isolated, come from marginalized families, come from poor families, and they are not adjusting in the milieu of the college, and that also is a very high risk for depression. Families who have lost their jobs. In fact, if you look at the NCRB figures, family hassles and other causes are very important causes for suicide. Families who have fathers who have lost their jobs, mothers who have lost their jobs, and there are financial hassles which they are not saying. A lot of families have EMI pressure. They have bought a house and they're paying EMIs, the jobs go away. And these are the issues which really are very important. When a teacher or any adult who's interested in the affairs of children find that a child is not coming to school or college, don't make a phone call but make a home visit and find out whether the child is depressed or not. Even at the risk of becoming unpopular, please escort them to a friendly psychiatrist or a psychologist.
I want to bring in Abbas. Yeah, Abbas, the truth is that in the world of WhatsApp and Facebook and Instagram and Snapchat and all of these other things, young people are living very public lives, which means that you're constantly under pressure to look as good as everybody else, to be as successful, to be as popular. And perhaps in the 80s, when the rest of us were growing up, we weren't under that much pressure to always be on top of the pile, on top of the cart. Is that perhaps adding to the kind of stress that they're facing?
That's definitely adding to the pressure because in the world of social media, there is this need for approval. Today's youngsters, today's teenagers, they have pretty much lived with social media for most of their lives. So there is this need to impress whoever's looking at them, and that adds to the pressure that they're going through as it is. So
like doctor said, WhatsApp, Facebook, Twitter, they're great mediums to express yourself also. But once in a while, do unplug yourself, go out, look at the world, get inspiration from what you see outside, meet people, talk to them, meet new people, go visit a library. We don't visit libraries anymore. I am telling you from my personal experience, when I used to feel down and depressed, a visit to the library used to sort of fill me up with so much joy because I could get my own space. Libraries aren't loud places, they're calm places. I could go, I could sit with a book, and I could be around people who also are in that same level of calmness. So to unplug yourself, to not worry about if you're impressing people, how many likes you're getting, if you're saying the right thing on social media, if you're putting the right kind of picture, if you're choosing the right filters, those are things that should really be the second or third thing in your line of thought. Be comfortable in your own skin, be happy with who you are. And that's something that social media is kind of taking away brick by brick, layer by layer, because it puts that pressure on kids and adults that you have to be presentable, you have to show that your life is magnanimous, your life is amazing.
Yeah, Kashyap?
Faye, it's very interesting that you asked that. I don't think social media really is the problem. I think it compounds the problem. The real problem is what we're bombarded with in the sense that mainstream media, advertising, all of them kind of tell you there's a certain way to be, there's a certain way to live. A lot of people tell me, Kashyap, floral shirts are so out of fashion, why are you wearing it? Makes you look ugly. I think sartorial sensibilities are not diverse enough. People do not think poverty is sexy. I think these are all things that are just part and parcel of life. If you start taking it too seriously, or just like in the moment you feel like there's so much embarrassment or shame that you can't do anything about it, I think that's where it starts becoming a problem. If people just say, okay, you can be any way you want to be and every way is the right way, I think it just becomes less stigmatic and less of a taboo, you know.
All right, we received a couple of phone calls from people who didn't want to join us on the phone but gave us their questions. So I'm going to read out these questions. Geeta called us from Chennai. She says she's 61 years old and she is lonely. Her kids have become busy. She says, my kids are busy. They don't meet me anymore. I have no one to talk to. I do not know what to do. Sheila Shah has also called us. She's 70 years old. She says, my 2 sons don't see me anymore. I have 4 grandchildren, but they don't talk to me. I want someone I can speak to get rid of this depression. Shrradha Sidhwani, what can these 2 people do?
I think what they need to identify is a very good support mechanism. Of course, the expectation from the family, meeting kids, grandchildren is high, but we also need to start understanding what realistically is possible. But maybe they can join some social groups, go in for some exercise programs. A lot of us also can start pursuing hobbies which we've always wanted. We've not had the time through work and through a hectic lifestyle. Maybe join in some music, any form of dance, and pursue something which we have been passionate about. There are a lot of laughter groups. There are a lot of senior citizen groups right now in the city itself, where they have weekend visits, they meet up, they discuss issues, they bond with each other. I think that could be a good support system for people who are actually lonely.
No, I want to bring up this at this point, Dr. Sagar. Now, here's the thing. When someone calls us, and these ladies have called us right now saying that they feel depressed, they feel low. Again, how do they tell the difference between my children haven't met me, so I'm lonely, or am I depressed? How do we know the difference between the fact that I'm just lonely because I don't have family around me and I'm depressed?
Yeah, that's a very good question, ma'am. The thing is, we need to differentiate boredom from clinical depression. We need to differentiate what we call as everyday depression. Something doesn't go right for you on one particular day and you're feeling depressed, from clinical depression. Suppose we consider this case, the lady feels that her children have not been calling her up, have not been speaking to her. Now, if they do call her up in the middle of the night, or they call her up tomorrow, if the lady really jumps up and she is very happy and she feels like, okay, whatever I was feeling up till now was just a transient thing, then I would say it was just the frustration, it was just the feeling of loneliness that was coming in. But if the kids do call up, the kids do come to the home, the kids do whatever she feels is expected of them, and still she feels low and still she feels that she is very lonely, then we can say that yes, at the brain level there has been certain chemical changes which now need treatment in a very specific way. So I think that applies to everyone.
So here's my question. If the individual also thinks that because my children don't call me, that there's no point in living anymore, is that a dangerous thought that needs immediate attention?
It is a very dangerous thought, and as Dr. Shetty sir said and ma'am also said, that anybody who voices suicidal concerns, we should not take it lightly at all. Anybody who voices any kind of feeling that he wants to end his life, or that he is worthless, or he is hopeless, you must, it's a rule, it's an unwritten rule. I request everybody to follow it, that you please go to a psychiatrist or a psychologist, because at that point of time, the person is not really thinking well, and we do not know, depending upon his baseline personality, how he will react to that situation. This is not a job for, like the friendly neighbor. I think you need to visit a psychiatrist.
Do not self-diagnose.
Do not self-diagnose. Let's not be Google doctors. Please go to the experts for this if somebody voices such a concern.
All right, I have more callers coming in. Dr. Shetty, I know you wanted to add to that, but I'm going to take another caller, then I'll take both of those questions to you. Rashmi is on the phone line from Bhopal. Rashmi, go ahead.
Yeah. I'm an adolescent consultant, and I have seen quite a few adolescent and even older people who are depressed, but who refuse any kind of help, whether it is going to the clinical psychologist, whether it is going to the counselor or whatever. In fact, when they are asked to do this, they become very destructive and close themselves up. Is cognitive behavior disorder therapy a point where these children can be helped?
Dr. Shetty?
Rashmi, thanks for the question. If they are not suicidal and if they are willing to go to a therapist for cognitive behavior therapy, I think that should be a starting point. Once we engage the young boy or girl in therapy, and as a therapist yourself, you will understand that whether the cognitive behavior therapy reaches the child or not, and once you have established a rapport, then you will be able to really guide the child to either a psychiatrist or continue therapy, and that's a very great start. But when some children really don't go anywhere and they talk about death all the time, and they just refuse to go anywhere, it's important to send somebody home so that they're assessed. Just like state governments, Anganwadi workers or health post workers go house to house to really check for malaria, dengue or tuberculosis. Anganwadi workers, health post workers can be trained to check for depression, screen for depression and suicidal behavior. I've been talking to municipal corporations for long, but I've failed to really convince them that an Anganwadi worker or a health post worker can be trained to screen depression, not diagnose, so that they can be referred to somebody across. So as Dr. Sagar said, and my psychologist friend also said, one thought of suicide, you have to send him or her for screening, for a mental health checkup to see whether is there any depression or is there any other issue which he or she is troubled. So thank you, Rashmi, for the question. CBT is one of the best methods for treatment if it is mild to moderate and not when it is very severe, because when the depression is severe, yoga, vipassana, counseling and psychotherapy may not reach the patient. Once they are a little better, all these things can work. But mild to moderate depression, yes, start with CBT immediately if they are willing.
Right. I also have Akshay on the phone line from Delhi. Akshay, go ahead. We can hear you.
Yeah, hi. I just wanted to share my own personal observation about a simple thing that earlier in the 80s we had far more space in our colonies. So kids would be able to play in the lane. Now they can't. Okay. So I think the onus is a little bit on the RWAs to understand this issue and convert a lot more of their sports grounds, their gardens into sports grounds, and figure that out instead of just
because one of the things that have been pointed out is that if you have a teenager at home or a child who doesn't exercise enough, then it's very likely that that person will slip away from you and into depression. I have another question here for Shrradha. Shrradha, you did mention, Shrradha, that alcoholism or the consumption of alcohol is a depressant. Now, as a parent, how do I know if my teenager, and now we know kids are trying things out very early, how do I know that my teenager isn't just being mischievous or hasn't just gone out and tried a drink the occasional time? How do I know if it's a problem? And it's a problem that needs professional help.
I think over time, if you have a teenager who's indulging in any form of addiction, whether it's alcohol or nicotine, smoking, I think you will see some signs of behavioral change. The classical sign would be anger, aggression, throwing tantrums, being rude to the parents or to her friends, distancing yourself from parents, from family, alienating yourself. There can be some money laundering. So there are classical behavioral signs which will sort of give you a hint that, my teenager is going out of boundaries.
Right, and I want to bring in, Satya's on the phone line from Bangalore, after which, Rishi, I can see your hand up. I'll come to you. Satya, go ahead.
Hello, ma'am. This is Satya from Bangalore.
Yes.
I'm just watching your program. With respect to this, elderly people about their depression, I have an idea. I started with this. In fact, it is even I feel a kind of therapy for myself also. There are many elder people, they're just alone staying at home. Most of them, whether they are educated or not educated, they have some knowledge.
Yes.
So it's like, they want to pass on their knowledge to somebody else, but they are not able to do that, especially retired people. So I have some idea from long time that I want to gather these people and bring them together where there is a need for that knowledge. So in that way, when we make them active, when we bring them out of that routine work, that can be a kind of therapy. It can bring down their depression. In fact, I tried with some 2-3 people. It really works. In fact, I learned lot from those people. So this is just an idea. If somebody starts in a big level, it will be very good.
That's a fantastic idea. In fact, let me bring in Hrishikesh Kanan. Rishi, we all have parents who perhaps live in different cities from us. They're retired, they live alone. There's always a concern of their safety. But unfortunately, we focus on their physical safety or their physical health as opposed to focusing on their mental safety and their mental health. How important is it for all of us to keep an eye out on whether or not our parents are depressed? And this is a great suggestion that was just made, that maybe make sure that they're meeting someone. All of us on this panel can work together to create a system where the young and old can actually help each other out.
And this is where, one can use technology, use the FaceTimes of this world, the Skypes of this world, and the fact that we are rapidly connected by constantly going and meeting parents who are out of town. But the point I wanted to make, Faye, was a couple of things on this debate that I heard and I wanted to comment on. One was the fact that early on in the show you said there's a telephone line and there is anonymity, so you can call and talk about your problems even without taking your name. And at the other end of the spectrum, there was Dr. Shetty, who said it's very important to get professional advice and the right professional advice. Something really dangerous is also happening with the expansion or the popularity of seeking advice and therapy, is that a lot of people have started dispensing relationship advice in particular, and these are non-professionals, and the media is also partly to blame. You switch on the radio in the night, there are anonymous callers, they don't need to take their name, but radio presenters, for example, have suddenly become shrinks. On any given night, they're dispensing advice on love, on romance, on sex, on relationships. Likewise, in print media, you find celebrities as well as, journalists writing agony aunt columns and dispensing relationship advice. And I think that's a very, very dangerous trend. And we in the media need to look inward and say, are we doing the right thing? It's one other thing to get a professional counselor on air with you if you're on the radio or television like you're doing right now, or on the print media, whereas you have one celebrity moderating, but you have the advice being dispensed by the professional. I don't see that happening enough.
That's an excellent point, Rishi, that we do, of course, need to be careful about where the advice comes from, who the advice comes from. And that's another very good question to ask. Dr. Shetty, How does a family, so if let's assume we're talking to a family who suspects or has discovered that a family member, whether a senior citizen or teenager or just someone who's working, might be depressed. How do we know whom to take that person to? A psychologist, a psychotherapist, a psychiatrist, to your local doctor? Where do we go?
Satya gave a very good idea. Bringing old people together brings sense of belonging, and getting sense of belonging is also an antidote for stress being converted into depression. When a family finds their children or one family member different, don't hesitate to go to a psychologist or a psychiatrist. Don't go to an astrologer at all. Don't go to a friendly neighborhood counselor. An emotional aid worker or a mental health soldier or a frontline counselor's job is only to give, to provide support, reassurance and access to mental health services, and not give any half-baked counseling, as Rishi just said. So if you are in doubt, go to a psychologist or a psychiatrist, friendly psychologist or a psychiatrist in the neighborhood, or also to a medical college where you may have psychologist, psychiatrist, and screen your family member for depression. Please don't go to quacks. Please don't read any agony and columns. Mental health is not rocket science, but at the same time we need to understand that we need to seek professional help and not help from quacks. Though a lot of people who are in stress may do extremely well with babas and gurus, but don't take the risk. When in doubt, see a psychologist or a psychiatrist. Just adding about the alcohol bit, a lot of people who are depressed also take alcohol. Alcoholism and depression are cousin brothers. So people who are depressed take alcohol, and you need to see the depression behind the alcoholism. People who take alcohol are 100 times more prone to commit suicide than normal people. Is something we need to really understand and accept.
Okay, so don't attempt to self-diagnose. Don't Google symptoms and then diagnose whether or not you or your family members have it. Be very careful of whom you approach. Make sure you go to a proper doctor. Ask for recommendations if you need to, and of course keep an eye out. Anybody with any sort of substance abuse problem, whether that's alcohol or drugs, don't brush it under your carpet. If you find that your teenager at home has come home drunk, that's something that you should be very concerned about. We have an anonymous caller on the phone line from Delhi. Go ahead.
Hi. A few years ago, I suffered a major business loss, and since then, I've been under a lot of stress.
Okay.
And that stress is still continuing. With one of my friends' advice, I have been taking ashwagandha for last 4 or 5 months, one tablet once in the morning. So I just want to know that does it get addictive? And
okay,
is it a symptomatic temporary relief that I'm getting? I'm definitely feeling better. Is it a symptomatic temporary relief that I'm getting right now, or is it something permanent that it is curing?
Okay, are you feeling better with the use of this ashwagandha?
That's right, yes I am.
You are. Dr. Sagar?
Yeah,
what is ashwagandha? Do you recommend it?
Ashwagandha is an Ayurvedic product. I would not say it is a bad thing. It is a good thing. It's like a brain tonic, one could say. But again, as Dr. Shetty sir said, that this person has suffered, the person from Delhi has suffered from a business loss. He says that the stress is continuing. Again, I would really request him to go and see a professional, because if he is depressed, we need to know the level of depression. After knowing the level of depression, we need to ascertain whether only psychotherapy is needed, only whether medications are needed, or both are needed. Ashwagandha can be a very good supplement. Suppose someone is eating food. When we eat food, we have chapatis and we have dal, and that is the main thing. And the salt or the achar that we take, the pickle that we take, it is a supplementary thing. So ashwagandha is a similar thing. Suppose you're depressed, you take the main medications, you take the main therapy, and this could be a good add-on, but not at all the main therapy. This really needs to be understood.
His concern was, is it addictive? And a lot of people will be concerned that if they get put on antidepressants, that it might be addictive and they might wind up addicted to something.
Yeah, I think that's a very good question. It's a very, very widely spread misconception amongst almost everybody that once you started on antidepressants, you are dependent on that. I would like to clearly state that all the medical literature all over the world says that antidepressants are not addictive. Many people also start antidepressants, they start feeling well after a certain amount of time and they stop it on their own. That is also a very, very harmful practice because the chances that you'll again get depressed are very high. So if you are depressed, antidepressants sometimes have to be started. They are not addictive and they must be taken till your doctor advises you to take so, and not just stop them in the middle because you're feeling all right.
Dr. Harish Shetty, what are the side effects of antidepressants?
There is no drug on this earth which has no adverse effects. So the newer antidepressants have lesser adverse effects. The older antidepressants have had side effects. Little nausea, mild vomiting, dryness of mouth, constipation are some of the adverse effects. And the effects of the antidepressants outweigh the adverse effects. What is very important to know, as Sagar said beautifully, that are we addicted to food if you are eating food every day? And similarly, if you are supposed to take antidepressants or one tablet or whatever, one episode of depression would mean at least 9 to 12 months of antidepressants, and the word at least is very important. And the doctor will decide whether it has to be tapered or it has to be continued. More episodes of depression would mean that antidepressants may have to be taken for a longer time, and again the doctor will decide whether this has to be tapered or stopped. So the entire myth about antipsychiatric medications are that they're addictive. Though anti-anxiety drugs, benzodiazepines, are addictive, and it needs to be given for a very short time and it should be withdrawn. Now when you say anything is addictive, it has to fulfill two conditions. One of dependence and tolerance. Tolerance would mean that you need a higher dose continuously to get the desired effect. Dependence would mean once you stop the drug, you get withdrawal symptoms. Some antidepressants may have withdrawal symptoms if stopped suddenly, but it has to be actually tapered. So just like food is not an addiction because we need it, antidepressants are required because we need it. And in Marathi, in Maharashtra, we say bhaji, poli, ani goli. Just like in my plate, if there's rice and vegetables as a South Indian, and I might have lime, a person who's depressed may have rice, vegetables, lime, and a tablet. So it's part of his diet, and that is something we need to really understand and accept.
Right, and understanding and accepting a family member who needs to see a doctor for their mental health is also a very, very large part of being able to bring that person back to being whole again or to being healthy again. Apurva is on the phone line from Mumbai. Apurva, go ahead.
Yeah, good evening. I've been watching this excellent discussion. Two questions. I wanted to ask you, how does one find a good hospital where a person who is suffering from depression can be cured? Second thing, does any yoga exercise will help a person come out of depression?
Right. So, you know, here's the interesting thing. I was doing some reading and I discovered that the state of Kerala has created depression clinics in every government hospital. Unfortunately, I don't know if we're there yet in all of the other states. We should be there. If Kerala could have come up with that idea, which means it's possible in our country, and they've recognized that it's an issue. Shraddha, there was a lot of mention of exercise and yoga.
I think it's a great effort.
Yeah, but what is the recommendation if someone has a family member who they think is unwell? What should they do? Where should they go? Let's just take any city, for example. Should I go to the hospital?
I think if we start from the young adults as well, even from teenagers, the first place you can go to just a school counselor. In the college setup, you can go to a college counselor. Now, when you're not comfortable because of the taboo or because you think people are going to see you there, they're going to question you as to why you're there sitting with the counselor, maybe you can go to a private clinic or to any government hospital. We have fabulous facilities even in Maharashtra. We have private hospitals which have a psychiatric clinic. There are psychologists working with them on a full-time basis. There are inpatient setups as well for people who are depressed. They can check themselves in, we can do an analysis and we can start the treatment immediately.
Okay, and
so even if you need to, even if you need to go to your regular doctor, which is your general practitioner, I'm sure he will also send you off to a psychiatrist or a psychologist for evaluation. Yeah, if necessary. Yeah.
I also want to bring in Sana Iqbal. Sana, you know, the call that we received where the gentleman said, I lost my job or I had financial difficulty a few years ago. And he's still taking an Ayurvedic medicine recommended to him by one of his friends, which means he has not, he is yet to seek professional help. He's been living with this problem for several years. It's like developing a rash and not doing anything about it and just, you know, just living with it. This is the sort of thing that we realize in the country that people are not talking about it, Sana.
Right. So, see, a lot of times it happens that there is a bad incident that happens and people are just not able to overcome that bad experience. And that is when, you know, a lot of negativity crops in. Now, for the caller, I would like to suggest something. First, definitely, you know, follow what the doctors have advised. Get a proper checkup done to identify whether he actually has depression or not. Now, the second thing, what I would recommend personally is, he must identify regular goals for him. Like, for example, what I did, have a goal for myself in place wherein I would have a small goal. It's like baby step. You know, today I want to accomplish these 2 things. And by the end of the day, if I accomplish those 2 things, I would feel very happy. And then again, next day, the same cycle follows. So what happens with this kind of therapy is you are, you know, directing yourself towards happiness. You are distracting yourself from the negative things which are not even affecting your life anymore. It's all in your mind, you know, it's how you think about all these things. So this is one piece of advice I would like to share, especially with the caller and at large with everybody else who is watching the show right now. Now the second thing, you know, I really wanted to ask this to the doctors. My personal experience when I was interacting with the students, I was conducting a lot of seminars, and even now, you know, when people reach out to me for some kind of help, they, you know, I ask them if they have actually reached out to a professional counselor, a psychologist or a psychiatrist, and most of the times, 95% of the times, the answer is that is expensive, I will not be able to afford that. Now we know that, you know, no matter how much salary we are, you know, generating every month, it's always hand to mouth. You know, the kind of expenditures everybody has, it's very difficult
that's a good question,
take out some money out of that.
Let me, I've run out of time. Sagar, very quickly, is it possible to get almost free or very affordable help?
I think it is totally possible. You go to any government hospital, you go to any medical college, most of them, at least in Maharashtra and I think all over the country, have got a psychiatry department where you can get yourself tested, whether you are having depression, whether you are having any mental health issue, for free. So I think the argument made might be true for her, but in majority of the cases, it is the taboo that is associated with depression which prevents people from going to a professional and not the fee. I think that's a very minuscule issue.
All right. We've run out of time, unfortunately, on this show, but I want to thank every one of our panelists who've taken the trouble to be part of this conversation. You've made a difference today to someone who is watching at home who knows a little better. And we're going to, and I make this commitment to my audience today, we're going to talk about depression on a regular basis. If you get in touch with us on the contact details that are on your screen at this point, we will pass you on to someone who can help. Whichever city you are in, we will create a roster of doctors who can help you, and we will pass you on to someone who will look after you and make sure you're okay. For the rest of us, we just need to keep an eye out. Our lives are busy, I know. We spend a lot of time between work, accomplishing what we want to do. But look at your family members a little more closely. Look at your friends a little more closely. Try and understand their behavior. And if you don't understand their behavior, that might be a red flag. Talk to them. If you're not able to get a good enough reason for that behavior, then make sure that they see someone and that they get the help that they need. It is absolutely paramount that we don't look away, or we don't say you're just seeking attention, or we don't say that, listen, get over it, because once we lose a person we love, nothing can bring them back. And that is just a thought that's far too scary to see through. I leave you tonight with 2 things. Keep an eye out for your family members, and if you are in fact in distress, reach out. If not to anyone, then to us here on Mirror Now. Thanks for watching.